Hi there, it's Justin Lubino again with Senior Advisors, and this short video today I put together because I've really gotten quite frustrated with some of the issues we've seen to be experiencing lately in higher volume. So these issues have to deal with provider billing incorrectly. So essentially, doctors' offices and other facilities that are billing Medicare patients incorrectly. So let me start by saying this is not generalizing every single provider that's out there, but we definitely have seen an influx in the last few months of higher issues, higher numbers of issues related to incorrect billing. And this creates a lot of confusion and financial stress on Medicare beneficiaries. So it's a big problem. I'm definitely not happy about it, and I wanted to just bring it to your attention. So if you're experiencing one of these issues, you know what to look out for. So I titled this video "Don't Pay That Bill." Again, I'm not generalizing every single bill that you receive. There may be a valid bill that's out there, but this video is really related to some of the issues we've seen recently. I'm also going to caveat that the majority of our clients are on Medicare supplements. So these examples we're going to look at in this video are related to overbilling and billing issues for individuals that have a Medicare supplement. These examples do not apply to Medicare Advantage plans or folks that do not have a Medicare supplement. So the three different examples I'm going to walk through, the first one is a situation in which the provider actually billed the wrong plan. So if the provider bills the wrong plan for the health coverage, obviously it's not going to be paid by that insurance company or that plan because it's not covered for that service. The other example is a billing of an old plan. So prior to going on Medicare, the individual may have had a group health insurance plan, and the provider may still have that record on file and did not update to the correct Medicare plan, and they billed the old plan. That's another issue that results in a bill that the individual should not have to pay. The third example, which is the most egregious of them all, and borderline fraudulent, is an overbilling example that came up recently, and this one really got me fired up, and I think this was the straw that broke the camel's back, if you will, to create this video. So I'm going to walk through these three examples quickly so you know what to look out for if you're getting a bill that doesn't make sense to you. The first example here, this is the billing of the wrong plan. So for this individual, they had a doctor's appointment, doctor's visit, and they actually got an explanation of benefits back from a provider. So this is not a bill. So let me be very clear. You don't have to, if it's an explanation of benefits, it doesn't mean you necessarily owe the money. It's not a bill, but they did get a bill that associated with this number as well for $135. Which they did not understand because they had already met their deductible for Part B, and they have a Medicare Supplement Plan G, and they didn't understand why they were being denied for this claim. Well, when we dug into this a little further, it turns out the plan that the provider was billing was the Part D drug plan. This member ID, which is whited out for identity purposes, was actually associated with the Part D drug plan. So this was not the Medicare supplement. The bottom line is the provider should never be billing the insurance company for someone that has a Medicare supplement. The provider needs to just bill Medicare. Medicare pays the provider, and then Medicare sends it to the secondary to pay the remainder of the bill that they're responsible for when you have a Medicare supplement. So, again, this I think is not necessarily an intentional error, but the provider just maybe they were incompetent in this example, but they billed the drug plan for this service. So once we figured out what the issue was, the doctor went back and billed the Medicare for the doctor's visit, and everything was resolved correctly. Okay, so that's one type of example where the the provider's office billed the wrong plan. The second issue is billing an old plan. So in this example, the client received this bill for $57, and they're trying to understand why. They've got this great Medicare supplement. They'd already met their deductible. Again, it was a Plan G Medicare supplement, and they shouldn't have to pay any other medical costs the rest of the year. Why am I getting this bill for $57? Well, the bill says the claim was denied by their provider. The problem is this is not the Medicare supplement provider. And again, the provider should not be billing the insurance company when you have a Medicare supplement. The provider needs to just bill Medicare. Medicare pays its portion, and then Medicare sends it to the secondary to pay its portion of the bill. So you should never, at a provider, should never be billing a carrier directly when you have a Medicare supplement. Medicare Advantage is a whole different animal. Again, I started at the beginning of this video. This has nothing to do with Medicare Advantage. In that case, they are billing the insurance company because you're no longer on original Medicare. But the majority of our clients have Medicare supplements, and therefore the provider should be billing Medicare, and then Medicare sends it to the secondary to pay their portion. So again, we went back to the provider updated the billing and billed it correctly, and everything got resolved, and the patient was not responsible for this bill. Okay, the issue with all of these examples, there's one more example I'm going to walk through, but the issue with all of this that's most frustrating, I'm certain there's a percentage of people, is it 50%, is it 25%, I don't know, that just pay these bills. They say, oh, I owe this money, I'm getting a bill from a doctor's office, and I'm just going to pay this bill. And we don't necessarily like to spend all of our time dealing with these types of issues, but I'm glad that our clients are reaching out to us, so we're getting these things resolved correctly for them, and they're not paying these amounts that they shouldn't be responsible for. I wish the providers' offices would get it right the first time, because again, I'm certain there's people that are out there paying these bills that they shouldn't be, and I'm pretty certain that the providers' offices are not going back and finding these issues and paying them back, which they should be doing. So that's the second example. The third example, and this one's the most egregious of them all, and this one really got my head spinning, but one of my clients got this bill for almost $500. And again, she has a Medicare supplement Plan G, and the most out-of-pocket expense you should ever get a bill for with the Plan G is the Part B deductible, which this year is $185 in 2019. So to see a bill that's almost $500, I really dug into this one. And what we found out, and you can actually see it right on the bill, but I wanted to confirm this with the carrier as well, is Medicare. So they did bill the Medicare, and Medicare basically approved about $95. The total service amount was it looks like over $600 for what the provider billed, but Medicare only approved about $95. So in this example, Medicare pays the 80%. Which is about $75. The check here for $19 is from the supplemental. That's the other 20%. So that was paid correctly by the supplemental carrier. And the provider has the nerve to go back and balance bill the Medicare beneficiary for almost $500. This is completely egregious and like I said earlier, borderline fraudulent. And I've intentionally left the providers' names on each one of these examples because I really want to bring attention to these issues and hopefully help to reduce these issues from occurring in the future. But in this example, the provider knows what happened. Their systems know what happened. They got paid by Medicare. They got paid by the supplemental, the full amount that Medicare approved for the service, and they still went ahead and tried to balance bill the patient for the $500. So they cannot do this. If Medicare only approves the $95, that's all the provider is eligible for. They've agreed to that. When they agreed to accept Medicare, they agreed to the Medicare approved amounts. Some providers elect to charge excess charges, which can only be up to 15% above the Medicare approved amounts. So in this example, even if it was excess charge eligible, that would be $15, not $500. So, once it went back to this provider as well, got this, clarified with them, got this resolved. But, this one was very frustrating because, again, a certain percentage of these people are just paying these bills without even questioning it. And, it's a shame that this is going on. And again, this video was to bring these issues to your attention. Not to say every bill you shouldn't be paying. But again, if you have a Medicare supplement, and specifically a Plan G, the only medical cost for that entire year should be the Part B deductible. which this year is $185. So you should know if you ever get a bill above that, that something's definitely not right. The bottom line is never pay a bill until you get an explanation of benefits from Medicare and from your carrier that aligns with the billed amount. Okay, you should always get an explanation of benefit, or EOB, that aligns with whatever's being billed. So the numbers should match up. If the numbers don't match up, then something is not right. Okay, and then here's our little plug. If you work with us at Senior Advisors, you'll have us in your corner. I mean, we'll help clarify and resolve these issues. We don't like to see these issues from providers, but we definitely don't want our clients to be paying things that they're not responsible for. So if you're not working with us today, you can certainly reach out to us. We are not a fee-based shop. We are commission only. So if we help you either switch your Medicare supplement or enroll in a Medicare supplement, we do get a commission from the insurance company. You do not pay us directly. You do not pay more for your Medicare supplement. If you use a broker, you're paying the same exact amount, whether you use a broker or you go directly to that insurance company. So it doesn't cost you anything to work with us. We'd love to have you reach out if you have any questions. You can go to our website or you can give us a call, and we can certainly help you with your Medicare planning. All right, I hope this video was helpful, and I hope you have a great day. Thanks a lot.